Facelift or something else? I'm 47 years old, and this is what my lower face looks like. I had Ultherapy last year with no help. Plastic surgeon who did Ultherapy stated that it was too early for a facelift for me. I also had fillers to augment the cheeks in hopes of elevating the sagging of my lower face without any improvement. The laxity got worse very fast, and I really want to do something about it. I would like to know what is the right procedure for me, and if a facelift, what kind? What are the expected results after surgery?
Thank you for your question. You're 47 years old, and you've submitted several very good photos of your neck and lower facial area. And you state that you had Ultherapy with a plastic surgeon, which did not work, and your plastic surgeon said it's too early for you to have a facelift. With that understood, you had some injectable filler placed in your cheeks in an effort to try to lift the skin, and that, as you state, was not successful. So you are looking for some guidance as to what your options are. Well, I can certainly give you my perspective and certainly my opinion on how I approach patients like yourself. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I've been performing facelifts from the very beginning and have offered the full range of different facelifting and neck lifting procedures, as well as non-surgical options. And I can certainly explain to you a little bit about what your options would be if someone like yourself comes to our office. So when you look at the skin under your neck, there are certain issues that are relatively straightforward. You have some what's called platysmal banding. So certainly suggestions will come up like using Botox to relax the platysma. And then when you discussed a little bit about, or you described in your question about the fillers to help lift, it does bring to mind an option that is also with fillers, and it's one way of helping this issue, but not necessarily the only way. And what I'm just talking about is something called structural volumizing. You see, regardless of the placement or the intention of adding volume in the face, there is a real distinction on technique when it comes to using fillers to cause a lifting effect. When we do something called structural volumizing, we're actually placing filler such as Juvederm as well as Juvederm Voluma at the level of the bone structure. When it's at the level of the bone structure, it actually restores volume where volume is lost and allows redefinition and some lifting of the skin. Now, it's not necessarily the only thing that will help you get to where you want to be. The simple challenge with thermal energy devices, regardless of whether it's Ultherapy, whether it is other radiofrequency devices, whether it's ND-YAG laser device, which is what we use in our practice. I can tell you that skin remodeling, which ultimately is really what's happening, and I try to help people understand, there's a distinction between skin quantity and skin quality. There's a limited amount of overlap where skin quality creates enough tightening that there's some degree of elevation. But in general, the challenge really is the sagging of the underlying tissue, which limits the effectiveness of any treatment which involves non-surgical skin tightening. So when it comes to that question, there is a couple of different options. One option is the type of limited short scar facelifting procedure. With due respect to your plastic surgeon, I would say that there are definitely people who benefit from a limited amount of lifting where the soft tissue, including the mass, which is the muscle layer in the cheek area in the face, as well as the platysma, which contributes to those bands, when lifted, will actually relieve the tension on the skin. And that's a very important part of this. The other procedure that we also recommend is something called a suture suspension procedure. And this is not a thread lift. This is not the barbed suture technique, which is basically a procedure where skin to skin is being tightened in a way. But unfortunately, a lot of time there's a lot of regression, and that's what gave thread lifts unfortunately a lot of negative press. Suture suspension is actually a method of fixating the sagging tissue or elevating it to a structure that's more stable. In other words, what we're doing is essentially restoring tissue in a way where you don't necessarily have to actually open up the skin. And the point of that is that if your doctor, your plastic surgeon feels you don't have enough extra skin to justify doing a facelifting procedure, well, essentially the concept of suture suspension is doing the work that you typically do in facelifting surgery without removal of skin. And the reason it works is that the skin, depending on the age, of course, and the general resiliency of the skin, will actually retract when there isn't physical weight on the skin. Now that also means that if there is resuspension of the deeper tissue, then you can also get the opportunity to maybe revisit some type of thermal energy device tightening procedure afterwards to further enhance that. But a lot of times it's not necessary. Again, it has to be customized. So there are options for you. It is a challenging area. I certainly understand the frustration, and sometimes there aren't enough things because unfortunately there's like a disproportionate amount of aging that happens in the neck relative to the face. But in my opinion, it is often the best solution is a combination approach. And certainly you have been kind of visiting some elements of this, and hopefully what I'm discussing with you in terms of Botox for the platysmal bands and suture suspension may give you some other perspectives on options. So I hope that was helpful. I wish you the best of luck, and thank you for your question.